Hans Arwidsson of Eurocine will present his company, Eurocine Vaccines, and how they want to protect children against influenza. There you are. Welcome.
Thank you very much. And thank you all for coming here today. I'm Hans Arwidsson, Eurocine Vaccines, and I have a vision in my profession, and that's that we will, in a few years' time, be able to vaccinate ourselves with against influenza like this. A few drops in the nose, and that will protect us against influenza. But more importantly, the children needs better protection against influenza disease, because that's where the biggest medical need in influenza disease is today. And that's where we are heading in Eurocine Vaccines. And that is reflected by WHO recommending that children should be protected with vaccination against influenza in the age range between 6 months and 5 years of age. That has been implemented, that recommendation, in a few countries already. And there is one nasal influenza vaccine on the market today in the US and in Europe. FluMist is the label in the US, Fluent in Europe. And AstraZeneca and MedImmune, the owner of the product, has shown superiority of FluMist against injected influenza vaccines. And it's recommended for children in UK, Canada, Israel, Germany, and a few other countries. There is a flaw, though. It may not be given to children below the age of 2 years, people with severe asthma, and people with certain immune deficiencies. And that's where we see the big need in influenza vaccination, and that's where we are going to help. So we need a safe influenza vaccine that is indicated for this age range of children. Eurocine Vaccines' lead product candidate is Immunos Flu, which is designed to target this segment. And we have a goal to become the first nasal influenza vaccine for children below the age of 2 years. But having said that, it will also be suitable for other age groups like you and me. And there it will offer a much more convenient way of vaccinating against influenza. Immunos Flu is a seasonal quadrivalent influenza vaccine, which means that it contains all 4 influenza virus strains that are recommended by the WHO each year. But in contrast to FluMist, Immunos Flu is based on inactivated influenza antigens. The virus is splitted, and that is the component, the active component of the nasal drops. And it is formulated by our proprietary technology, Eurocine, which is designed to open up and help the vaccine act immunologically in the nasal mucosa. Where we are now is that we have partnered with a supplier of influenza antigen, and we are in the middle of the preclinical documentation, which is ready very soon. We will apply to the Swedish authorities for entering the clinical phase 1/2 study later this fall. And that will be the proof of concept of the product in man. Now I will take you through a couple of tastes of the science behind. The established animal model in influenza vaccination is the ferret. And we vaccinated ferrets against influenza with immunosed flu, and then challenged the ferrets with influenza virus. And it was amazing to see that all the ferrets, every single one that had been vaccinated nasally with immunosed flu, different strengths and also with different types of antigens, all of them were protected in lung tissue. Not a single virus was detectable there. But it may be even more surprising, it was protecting against any viral load in the nasal turbinates in all of the ferrets that were nasally vaccinated with split antigen. These results were amazing to key people in the area. Another taste from the science here is that flu mist, which is on the market and has been proven to be effective to protect against influenza, show approximately the same levels of neutralizing titers as immunosed flu does, which is a proof that this is very likely to work in the real world. But remember, the difference here is FluMist is a live attenuated vaccine. We have an inactivated, which changes the levels of side effects. So the split antigen that we have partnered to get the supply secured, we combine with Endosin. This makes immunosed flu. We will take that into the phase 1/2 study and license to partners. The key element is Endosin. And it is built on very well-documented and well-known lipids. And the point here is the processing of the lipids to make it work properly. It has been used in a number of subjects already in 3 clinical trials. And we've evaluated it in a panel of different vaccine antigens. The product appeals very nicely to vaccine manufacturers by its simple design. It's administered as nose drops, a single dose blow-fill-seal pipette, as I showed you initially. And it creates both systemic and mucosal local immune responses. And another part of the vaccine manufacturers liking this is that they can use the bulk active components as they are in the manufacture. So immunosed flu, a quadrivalent nasal influenza vaccine candidate, induces immunity where the disease enters. It has shown already complete protection in ferrets, the most established animal model in the area. And the next thing we are doing and starting this fall is a phase 1/2 study with immunosed flu. Thank you very much for listening.